Hello, my name is Dr. Alan Kerry and I'd like to welcome you to another podcast from South Essex GP Training website. With me I have Dr. Sunil Gupta and we're going to look today at the topic of mentoring. Sunil, can you give us a definition of mentoring and tell us what it involves?
One definition of mentoring is the process whereby an experienced, highly regarded, empathetic individual, which is a mentor, guides another individual, the mentee, in the development and re-examination of the mentee's ideas, learning and personal and professional development. In mentoring, the agenda is set by the learner. Mentoring is a safe place for reflection, listening and support, where strengths and blind spots are explored. Mentoring focuses on capability and potential. The mentor acts as a facilitator and there's a discussion of options that the mentee has identified, and mentoring is typically a long-term relationship.
What are the main reasons someone may want mentoring?
Some of these reasons could include things like wanting skills to manage change, difficulties at work, trying to make career decisions, issues with work-life balance and wanting to develop leadership skills.
And what are the benefits to the mentor and indeed to the mentee?
Benefits to the mentor include it refreshes the mentor's own view of the work and enhances their own job satisfaction. It encourages self-reflection in the mentor. It develops professional relationships and enhances peer recognition. A study has shown the following benefits reported by mentees who were doctors. They reported that mentoring helped to regain their confidence and job satisfaction, improved working relationships, enhanced problem solving, increased sense of collegiality and helped them in making career choices.
Are there any potential pitfalls in the mentoring relationship?
There are. It's important that mentoring is carried out appropriately because there can be some problems if there's failure to establish rapport, if there's under-management or over-management, if there's poor objective setting, if there's lack of time, or if there's a breach of confidentiality.
What do you think are the skills that make up a good mentor?
Some of the skills of a good mentor are that they're a good listener, that they're discreet, that they're able to give and receive constructive feedback, that they're able to display empathy and understanding, and that they're capable of viewing the role of a mentor as a development opportunity for themselves.
Could you give us an idea of what you think should happen at the first mentoring meeting?
Some of the things that should happen in the first mentoring meeting are introductions. There should be an agreement about the length and agenda of this meeting. There should be a clarification of expectations for both the mentor and the mentee, an agreement about what the mentor can and cannot do. The mentee should give an overview of their experience, strengths and weaknesses, and there should be an agreement of the objectives for the process, i.e. where is help needed, what does the mentee hope to achieve, and what does the mentee want to happen. And there should be an agreement for the process for the future frequency of meetings, e.g. 2 monthly. There should be agreement about where to meet, the preparation for future meetings and the communication in between meetings, e.g. email and phone numbers.
Okay, so what's the role of the mentor in these mentoring meetings?
The role of the mentor in the mentoring meetings is first to establish a relaxed yet business-like atmosphere, to agree the purpose of the meeting, and then to explore the issues from the mentee's perspective, and then to do one or more of 1, clarify, 2, challenge, 3, stimulate, and 4, draw on the past experiences of the mentee and or the mentor, and the other role of the mentor is to summarise.
So clearly good interpersonal communication is very important in mentoring. It's also an area which the mentee himself or herself may want to improve. Can you give an outline of what can be done to improve interpersonal communication?
So some of the skills for good interpersonal communication are listen with genuine interest, create a conducive environment, be encouraging, show understanding and empathy, check current understanding, reflect / summarise and paraphrase answers, use closed questions for explorations and use open questions for clarification, and adopt a similar language and avoid jargon. Some of the other skills for good interpersonal communications are use plural pronouns to indicate partnership, be provisional rather than dogmatic, be descriptive not judgmental, comment on the issues rather than the personalities, encourage eye contact, give information in clear simple terms and use repetition, check understanding and use silence.
Thank you. Finally, can you say a few words about what is best practice in mentoring and the stages which can be involved in setting up a mentoring scheme?
Some of the best practices in mentoring are that mentoring should be a voluntary process, it should be confidential, the mentor should be trained, assessed and supported, there should be bespoke matching, mentees are interviewed on the phone to explore their needs, there should be a careful choice of the mentor, there should be ongoing evaluation of the mentee and the mentor experience, and there should be a no blame policy. Either mentees can change their mentor if it doesn't work out. And some of the things to think about when you're setting up a mentoring scheme is you need to obtain the support of the key stakeholders and identify the resource implications of the scheme. It may be helpful to establish the role of a central coordinator for the scheme. You need to establish a pool of mentors trained in mentoring skills. It's worth developing a clear pathway for the matching of the mentee and the mentor, and you need to ensure that the potential mentees are aware of the scheme and what the process is of getting a mentor.
Thank you. Both Sunil and I would like to thank you for listening, and we hope that you'll listen to some of the other podcasts from the South Essex GP Training website.